Hello everyone, welcome back to our channel. Today I'm going to talk to you about hyperpigmentation. This is a skin problem that we see quite commonly in the clinic, and a lot of our patients have a lot of questions, and many of you, even from this channel, have been sending us lots of just questions on our social media about what the best treatments for hyperpigmentation are. So before I can talk about treatments, it's really important, like with anything, to try and understand a little bit about hyperpigmentation, what it is and what causes it. And before we can even learn about hyperpigmentation, it's important to understand how pigment or skin color arises normally in our bodies. So you've probably seen, I'm putting up a picture here of kind of the Fitzpatrick scale, which is sort of one of the more common things you see when in medicine or sometimes even in beauty, skin tone and skin color are discussed. To be honest, this is quite an outdated scale for a lot of reasons. It's quite restricted. It really doesn't tend to showcase clearly the diversity that is involved in skin pigmentation, but just for the sake of using something that everyone's familiar with, I'm just going to bring it up, and I can do another video and discuss sort of more accurate ways that when we look at pigmentation and hyperpigmentation, how we assess that. So in terms of pigmentation, the main sort of cell that is responsible for our skin color and giving us our skin color is really the melanocyte. These are cells that contain a pigment called melanin, and that is what is largely responsible for your skin color. So if you have more melanin, then you have more likely to have a deeper skin tone, and if you have less melanin being produced, then you tend to have a lighter skin tone. It's not always quite that simple, but this is just to kind of give you sort of the foundations of that. Within that, there are two kind of main types of melanin, and most of us have a mixture of these, pheomelanin and eumelanin. And so in terms of our skin color itself, there are the intrinsic factors. So we have our kind of baseline, which is what we're born with, and that's the sort of skin color. But then there are other external factors that affect our skin color, whether it's lighter or darker, in terms of the range from what we have inherently. So for example, if you go out in the sun, and that's the truth for all skin tones, then that kind of exposure to UV light will increase it'll be seen as sort of an irritant to the skin or some sort of skin damage, and that will spur the melanocytes to produce more melanin, because melanin is what protects our skin from the sun. So it'll see that kind of sun exposure as an injury or as a potential attack to something harmful to the skin, and your skin cells, the melanocytes, will deposit melanin in order to prevent the UV from damaging your skin, which is why most people, when you go out in the sun, regardless of your skin tone, your skin will get darker if it's not protected. Of course, if you're someone who is sort of, Fitzpatrick skin type 1, incredibly fair, then you're probably more likely, before you get a tan, to sort of burn in the sun, because there's not enough of that melanin that's kind of been produced to protect your skin. So that's sort of the thing with sun exposure, and this does unfortunately kind of mean that there is sort of really, it's a cliche, there's no such thing as a healthy suntan, because in order for us to tan from being in the sun, it indicates a certain level of damage to the skin that's being done. So that's that's the main kind of extrinsic factor. Other factors that kind of affect skin color will be things like some medications that may cause hyper or hypopigmentation, so they may cause the skin to become darker or lighter, and this may be in patches. So there are drugs for the heart like amiodarone that are known to do that. There are also skin conditions that also affect the pigment in the skin. So Addison's disease is an autoimmune disease, and one of the signs are kind of darkening patches in the skin. So I mention these because to show kind of the complexity and also the number of things that affect our skin. And so these are the things when someone comes to us and they're complaining of hyperpigmentation, we have to obviously first and foremost put our doctor hats on and make sure that there is not any one of those other conditions like, you know, Addison's disease I mentioned, sometimes diabetes can cause this, or they're not on a medication that's causing this. So what can we kind of safely treat in terms of abnormalities in skin color or hyperpigmentation? So hyperpigmentation itself is usually kind of areas where the skin darkens compared to what your skin normally is. So this could be large patches on the skin, it can be sort of spot areas, or they can be in kind of a distribution. So the most common cause of hyperpigmentation is melasma, and melasma is really basically caused by UV damage, so sun damage, photo damage, and that can look like sort of a rash or even sort of patches in areas that are most exposed to the sun. So that can be your brow, your cheeks. So that's something that we see very commonly in hyperpigmentation, it's melasma. Melasma's sort of cousin is chloasma, and again you get a similar appearance to melasma, but actually chloasma is hormone related, and the most common reason people have hyperpigmentation due to hormones is actually usually pregnancy. So chloasma is often known in medical circles as the mask of pregnancy because it kind of looks like a mask, and it's this coloration. So with chloasma, for example, because it's hormone related, usually treating it is about treating the underlying cause. So if it's pregnancy, usually we expect it to resolve after that period is over and the hormones normalize. Other causes of hyperpigmentation, and this is extremely common, and actually it's one of the things that causes the most distress, is post-inflammatory hyperpigmentation. So this is due to an inflammatory process. Most commonly, it's usually people suffering from acne, or breakouts, where then after that kind of period of having sort of spots, these settle or erupt and they leave a dark marks behind. This is something that we get a lot of complaints about, and it's most commonly in people sort of from the medium to deeper skin tone. You see a lot of that post-inflammatory hyperpigmentation, or it's more marked. But like I said, it's something that is can be particularly distressing, and so it's something that we see and treat quite a lot. Other causes of post-inflammatory hyperpigmentation, again, you know, remember this is an inflammatory process and your skin is fighting to protect itself. So things like using chemical peels that aren't suitable for your skin, or something that's either the wrong type of peel or that's too strong or it's been left on for too long. You also see it in, again, laser therapy, where similarly the laser strength may not have been appropriate for your skin, or maybe skin wasn't ready for kind of that dose of laser therapy. So with these situations, although they can happen to anyone, it's incredibly important. It's one of the reasons we really advise doing your research. If you're going to have chemical peels or laser, is going to somewhere where they will try and limit or reduce the chances of something like that happening to you by preparing your skin correctly, by choosing the right peel or the right laser for your skin. And again, post-inflammatory hyperpigmentation is more likely to see that, and more care needs to be taken in cases where someone has sort of a deeper to medium skin tone, because that is where you often see these reactions. So that's kind of the main causes of hyperpigmentation. what are the treatments? So as I mentioned, the treatment really depends on firstly your skin itself, your medical history, and the reason that you have hyperpigmentation. So if it's hyperpigmentation that is due to a medication, then that's something that needs to be discussed with the doctor that is giving you that medication. So for example, if it's like amiodarone, as I mentioned earlier, then maybe there is an alternative medication or something to do with the dosage. So it's not about treating the skin itself, it's the underlying cause in order to improve the skin. Problems like cloasma, again, that's hormone related, and so it's addressing the underlying cause of these hormones. So if it's due to pregnancy, it's usually a matter of waiting and often will resolve by itself. If there is another hormonal imbalance, then perhaps treating that in order to improve the skin. So treat the underlying cause. If we get to something like melasma, which is usually, it's skin damage, so there are two things that has to be done. One is to stop making it worse, and to adopt really good skin habits, regardless of where you live, regardless of whether it is a gloomy grey day or not, regardless of your skin tone. Everyone should be wearing SPF to protect their skin from sun damage. And sun damage, remember, doesn't just cause melasma, it causes skin cancer eventually. So it's really important to take this as a warning sign and to be strict about sun protection. In terms of the treatment itself for melasma, there are some really good treatments out there. So we really like using the Aubergine system, which contains either arbutin or hydroquinone, and we choose which one depending again on your individual skin condition and your skin needs. And these help stabilize the melanocytes, these cells, and they help even out the skin tone. So it will treat the hyperpigmentation so that your skin color is even throughout your skin. And again, it's important to have the right dosage, because what you don't want to do is change the surrounding skin. So you don't want to lighten the rest of your skin or darken it. You just want to keep it as it is and treat the problem, which is the hyperpigmentation areas. Aubergine is fantastic, and we tend to use it for moderate to severe hyperpigmentation. There's also Aubergine, so this is the Aubergine system, and this is great for mild to moderate hyperpigmentation. Again, it can have the basis hydroquinone, and it has ascorbic acid, vitamin C in that system, so it's fantastic for mild to moderate cases. We always, where appropriate, often combine either one of these systems with tretinoin. Tretinoin on its own is fantastic for acne, it's great for acne scarring, it's great for kind of skin wrinkles, fine lines and wrinkles, and it's also really good for helping treat melasma. In very mild cases of melasma, we may even try tretinoin by itself. So it's about the treatment that works best. These are all prescription products, and that's why it's really important to take a very detailed approach and a very medical approach to this, so that whatever course of treatment we recommend is always going to be the most appropriate one for you. The same goes with post-inflammatory hyperpigmentation. Again, the underlying cause, we will use the same treatments as we would for melasma, but with post-inflammatory hyperpigmentation, it's also about stopping the underlying cause. So if there is acne and you're kind of in the middle of that, we may want to initially start you on a set of treatments. So that probably will involve tretinoin if you're suitable for it. It may also involve Cleansiderm MD, which is the Aubergine system that clears up sort of mild to moderate acne, and so again, it's about that journey. If you have incredibly severe acne, then actually you may need greater help than that, and it may even mean having a treatment. We don't offer this, but it may be referral to a dermatologist, where you may have to start on Roaccutane or something like that. So again, it's about finding the appropriate treatment and the one that's going to give you the best outcome both immediately and in the long term, because we're not interested in kind of slapdash solutions, and none of our patients are either. So that's sort of where our approach to hyperpigmentation is treat the underlying cause and then find the best treatment to restoring your skin back to what it is. And after you continue finish the treatment course, it's about adopting really good habits to stop that from coming back again. So it's really a journey, and it's a journey that if you embark on it, so for example, we do all of this through our virtual clinic, and it means just having your hand held along the way and guided, and with all these treatments, you get what you put into it. So you will have a skincare routine, and if you're able to stick to that skincare routine, you really will start to see excellent lifelong results. I will do more videos about the different skin conditions that we treat in our virtual clinic. I will also do some of the professional treatments if you're interested, in terms of not just the Obagi treatments, but also chemical peels and laser therapy in terms of, and the role they play in treating hyperpigmentation. If that's something you'd like to see, please leave a comment below or send us an email and let us know. I hope you liked this video and found it was helpful. If you have any further kind of questions, I'm going to leave a link to our website and our newest page about hyperpigmentation, but also just leave us any questions you have about hyperpigmentation or any of the treatments we offer. Until next time, have a lovely day, and see you at the next video.